CPO Paul. Brandon has a manual knee right now. He wants to switch to a microprocessor knee. Can you explain how microprocessor knees work?
So there's different types of knees, microprocessor knees. The most common uses a hydraulic fluid. So when the person's walking, there's valves that open and close that are controlled by a computer and are programmed by the prosthetist based off of that individual. And as they're going through space and time and they're walking, their limb, the knee itself is bending and flexing and opening and closing those ports, controlling how fast the knee swings, how fast it goes, how much resistance to give it. Some of the other knees use a magnetic fluid. That's a little bit different. They have magnetic fluid and they have these fins. And as the person puts more weight through it, it sends a higher electricity volume to that magnetic fluid, and the viscosity of it goes higher, and then it gives it more resistance. They actually use that in Corvettes in the suspension methods. So that's one way. And then there's some microprocessor knees where they're only controlled in swing phase. Same thing, they usually use a hydraulic, but there's no stance flexion or there's no stance resistance. It's just closed when the actual leg is in the air through swing phase. That's on a very, just quick. Obviously, you can read the manufacturers and go into more details, but that's typically how they work. They're extremely safe, especially ones that use hydraulics and magnetic fluids. Depending on the knee, some of them are doing, hundreds of times a second reading the knee and where it's going in space, and they have, other things on there that control where it's at, and then they can program it for, if you're going down a ramp or stairs, or just when you're sitting into a seat. Obviously, some of them we can go into different modes. But overall, the biggest thing is they really reduce falls and they catch you. Most of them have something called stumble recovery. So if you misstep, the computer reads that as, oh, that's not a normal step for this individual. It's going to put that knee into high resistance to give you a chance to get onto your other leg or, grab onto the counter or something else to help you to reduce a fall. That's the biggest news is, Medicare realized this was a huge deal in reducing falls, that now K2 amputees are allowed to get microprocessor knees, where prior to that, that happened in 2024, that before that patients couldn't. They had to have a mechanical knee and they wouldn't qualify for that. But because it reduces falls so greatly, I forget the statistics, but it's somewhere around 5 to 9 times less likely to fall, which is quite significant, that knee is that much safer, and why they are allowing patients to have that as, a K2 amputee is a lower level than a K4 or K3. They're more likely to fall, and any amputee is likely to fall. I always say it's not a matter of time if you're going to fall, it's just when. And how can we reduce those? And hopefully don't fall, crack your head open, break your hip, cause other problems the other side. We want to reduce that as much as we can. So when in doubt, if you can and you qualify for a prosthetic microprocessor knee and it's the right knee for you, again, check with your prosthetist. I'd highly recommend it to help keep you safe. It's not one size fits all for everyone. It's not the best knee for everyone. I have a lot of patients that use hydraulic knees and mechanical knees, or they don't like it. But as far as reducing falls, it's a great knee.